everyone. Greetings, everybody. I'm Pooja from the beautiful Spotless Skin team, and I'm sure all of you all are keeping in good health. Welcome, everyone, to our special Instagram live session where we're going to be shedding light on acne and its management. Acne clearly is a condition that affects millions of people worldwide. It's not merely a surface issue, but it can deeply impact one's emotional well being. Beyond the physical blemishes, it can also erode a person's self confidence, leading to anxiety, depression, and even social withdrawal in some cases. Acne vulgaris specifically is a chronic condition affecting more than 85% of adolescents and young adults. Yet, despite its prevalence, there are still widespread misconceptions and stigmas around acne. That's why we're here today doing today's live session where we're aiming to dispel all these myths, promoting the understanding and empowering individuals to seek effective treatments. Today, we're going to be diving into the topic of acne management with our skin expert, where you're going to be learning about how we can really manage struggling with breakouts. And simply, when you're curious about maintaining clear and healthy skin, this session clearly promises both informative and engaging information. Today, we are here and we're honored to introduce Dr. Mahima, a renowned skin expert from Delhi, with us. Dr. Mahima is here live with us to talk about acne and its management. Dr. Mahima Agrawal is a highly experienced dermatologist with over 8 years of experience in treating various skin, hair, and nail conditions. She completed her medical education at the Maulana Azad Medical College and Lady Hardinge Medical College, University of Delhi. She's further honed her skills with a DNB in dermatology and MRCP SCE dermatology from the UK. Dr. Agarwal has made significant academic contributions, authoring scientific papers as well in renowned journals and chapters in dermatology textbooks. She serves as the associate editor of the Journal of Cosmetic Dermatology and also actively reviews for national and international journals. She's a regular teaching faculty at conferences, workshops, and also engages in public skin health awareness sessions. Today, we are completely privileged to have her with us, and she will be sharing insights on acne and its management. We extend our heartfelt gratitude towards the doctor for joining us. Thank you very much, Dr. Agarwal, for joining us.
Thank you so much for such a warm welcome.
So, Dr. Mahima, without much of ado, we wanted to dive in straight about the topic of what is acne and what are the different types of acne lesions.
Okay, so acne, we all have seen acne. We all know what acne is. Acne is basically the scientific name. Acne vulgaris is the scientific name, the medical name for a common skin problem, which we know commonly call as pimples or in Hindi muhase. So that is what acne is. It is a very it looks very simple, but it is very complex. It happens because of a complex interplay of so many things. The inside components of our body, our hormones, our diet, and our external applications, whatever we are applying on the face, the pollution, this everything happens together and causes acne.
Yeah.
So, as we'll go on discussing further, we'll answer more in detail about acne. Yeah.
Certainly, doctor. Doctor, another specific question that I had is that people say that the different areas where we get acne on our face also means something different. So, is it like different acne at different spots of our face is because of specific causes?
Yes, absolutely. Not like in 100% of the cases, but yes, the location of acne gives us a great clue. For example, if somebody is having acne mainly over the forehead area, that too near the hairline or near the eyebrows or in this area, wherever the scalp is attached to the face, in
Yeah.
this area, the acne can be usually because of excessive seborrhea in the scalp, which is excessive sebum means excessive oiliness in the scalp, or because of certain hair care products that one may be using. Another very common location is this T zone. When somebody
Yeah.
gets acne here, that is in the forehead and the central part of the face. This is mainly teenage acne. And a very specific correlation is the jawline and the
Okay.
inferior part of the neck, the inferior part of the face. This is mainly corroborative to hormonal acne seen in women, mainly in those women who have polycystic ovarian syndrome, that is PCOS, PCOD, which is earlier the name was PCOD. So very commonly we see acne here. These three, four areas are quite specific, but when it comes to other locations, they're not that specific or scientifically proven. Sometimes we see more of drug induced or medicine induced acne over the truncal area, like the chest, back, shoulders. So that is what has to play a role in.
Okay. Okay, doctor. So I think this gives us a fair idea that yes, your face is the mirror of what's happening in your body, and your acne could be telling us that story. Doctor, I've also heard about different grades of acne. So is there something like that?
Yeah,
If you can
absolutely.
enlighten us.
Yeah, absolutely. So, in order to understand the grades better, if I can talk a little bit about what exactly acne is. So, our skin, if we look at it on a deeper level or in at a microscopic level, there are a lot of things in the skin. There are blood vessels, there are oil producing glands, there are sweat producing glands, there are nerves, different types of cells, fat, collagen, hyaluronic acid, so many things are there. So, acne is nothing but it is the blockage of the oil producing gland duct. So, when this blockage happens, the acne occurs. When this blockage happens, the first thing to form is a comedone, which is called a blackhead or a whitehead in common terms. And after that, this gland is not able to release its secretions on the surface because the duct of the gland is blocked. So eventually the contents of the gland, they get ruptured inside the skin, which attracts a lot of bacteria. It causes inflammation. Then that proper pus forms, redness, pain, and all of that forms. So grading is nothing, but it is actually the how the acne is evolving. So grade one is very simple, just blackheads, whiteheads. Grade two is when a little bit of inflammation has started. That means a little bit of redness has started, red pimples they have started.
Okay.
Grade three is when the that pus formation has started. Grade four is very deep abscesses or nodules, nodulocystic acne, which we can feel like that, जिसे हम
Okay.
हिंदी में गांठें बोलते हैं. That is grade
Okay.
4 acne.
Okay. So I think, doctor, that's pretty informative, and for someone to analyze different grades is going to be difficult as well. But what sort of treatment can they really undergo if there is an XYZ grade acne?
Okay, so the grading plays a very important role. The type of the acne plays a very important role when it comes to treatment. So, when
Okay.
it comes to treatment, there is a pharmacological treatment, which means medicines and all, and there are some general measures. So, general measures are very important for acne. And this is something our viewers must learn. If somebody is suffering from acne, if somebody is watching whose child, a teenager, is having acne or something, somebody suffering from acne, they should watch their child.
Right. So, I mean, we understand that there is acne and different grades, and obviously there's different treatment for each of the acne as well. So this subject really gives us a lot of information about how we can treat acne and not get like really
On the
worried when
face,
you have a
they
breakout.
should wash their face.
Doctor, we're trying to catch up with the information that you're mentioning. I think we fairly understood that you spoke about keeping your face clean and hygienic. Doctor, we see your video paused at the moment, so we're trying to catch up while you fix up your network and we get to hear more of this information on acne and acne management, which is clearly so interesting. I'm sure in this session, we're going to learn a lot about acne. Like, I personally have dealt with acne as a teenager, and there was something called as acne rosacea that I suddenly got when I traveled abroad. And I mean, I can't express that it just led me to so much of losing of my self confidence, because I've always had like this really clear skin, which I don't know you can see right now or not. So I've managed to have this after a very long time with eating right, eating well, and of course, what you eat is what you are, and that's what I completely believe. So I would suggest my viewers also to ensure that they're eating right beyond just keeping their skin healthy. In the beginning that what you eat is what shows up on your face, and there are a lot of issues internally at times which shows up on your skin
Am I
outside. So
audible?
yes, doctor, I was trying to catch up with more information on acne and acne management and my personal experience with acne. So doctor, we are trying to hear you out, but we don't see you on the video at the moment. All I just want to tell my viewers is that if you get an acne, it's not the end of the world. You can always have that clear skin back, but make sure you're treating it right, treating it from within and externally as well. Uh, Another thing that I also faced is taking over the counter treatment. So I remember when I had purchased this over the counter treatment, it just did not do anything much to my skin, but I just burnt a lot of money. So make sure you're not just going out spending and getting different sort of treatments just because you feel that you can have flawless skin and you've got the best of the advertisements speaking about spotless skin. What I would suggest is go to a doctor. That definitely helps in understanding the root cause for an issue.
Hello.
Hello, doctor. We can hear you now.
I visible?
You're audible, doctor, but we can't see
Hello.
you yet. Yes, doctor.
Visible, audible, both?
You're not visible, but we can hear you.
Oh,
Yeah,
okay.
now we can see you as well.
Right. So,
So I just went on talking about my personal experience with acne and when I had acne rosacea. So I was just telling people that, just don't go out spending on over the counter treatments. Go to a doctor because that's essential.
that's very essential because everybody's skin type is different and
Yes.
really depends on the skin type. Like we were discussing about the grade of the acne. If
Yeah.
suppose somebody has that stage where just the glands are blocked, there's no inflammation, there's no
Yeah.
bacterial. So if we go on applying antibiotic creams, it's not going to help at all. So
Hmm.
it really depends what the stage, the grade of acne is, what type of skin you have. So yeah, like we were discussing the treatment, there are general measures that one has to make sure that they wash their face twice a day. It clear out the oil, the dust, dirt, and everything. Even if somebody is indoors, I see this very commonly that some people feel scared of washing their face. They just wash with plain water. However, that's not enough. Even if you're not stepping outdoors, you're not going anywhere. Our
Yeah.
skin really produces oil, sweat, all those things that needs to be cleansed. So
Yeah.
we need a cleanser, be it a simple mild one or a tough one. That depends on the type of skin.
Yeah.
Avoid oil preparations, oily, greasy applications on the face because
Yeah.
that's going to more clogging, blocking of the pores.
Yeah.
Shampooing, one may be surprised to know shampooing is very intrinsically related with acne. If we increase the frequency of shampooing, our acne also settles. So
Okay.
instead of just once or twice a week, I really recommend my patients to at least shampoo 3 to 4 times in a week. Another very important thing, not to scratch, pick, or peel acne because that can lead to a lot of marks, scars, and all. It seems very tempting, but better to avoid.
Yeah.
And yeah, one very common thing is that in India, when people get acne, they feel that we're not getting facials done or cleanups done. That is
Yeah.
why we are getting acne. They get those procedures done, which actually aggravates acne.
Activates acne. Yeah.
So, a very loud and clear message if you're getting acne or if you have acne prone skin, please do not get facials or cleanups. If at all you really like them, then use gel based products. So, these are some of the general things which everybody should follow. For specific medicines, there are a huge ladder of treatment. There are gels, lotions, the topical treatments. Then there are oral medicines,
Then there are procedural interventions. Like these are the specific things.
Yeah. So doctor, anything specific in the procedural treatments that you can mention, please?
Yeah, yeah, absolutely. Again, the procedural treatments also depend on the type of acne. For example, if
Okay.
somebody has just the clogging, that is just the comedones, blackheads or whiteheads, then we have a very good procedure called as comedone removal or comedone extractions, in which we remove those blockages. So we've
Okay.
just acne at its very beginning, like we've just nipped it in the bud. There's no
Okay.
more inflammation that's going to happen. But if somebody's
Okay.
entered into that inflammatory stage as redness, red pimples, pus, then very good treatments in the form of chemical peels and all are there. There are spot treatments where we apply spot peels. If we have some rescue treatments in the form of injectables into big acne cysts, there is
Okay.
drainage of the pus if there's a very big cyst. Then there are a lot of treatments. Procedural treatments are mainly for scarring. There are
Okay.
laser, microneedling, derma pen, derma roller. These are all types of microneedling. So scars के लिए we generally need procedure.
Okay. So, doctor, I was looking at sensitive skins, and they undergoing any sort of acne treatment. Do we have anything specific for them, by any chance?
Yeah. So sensitive skin means that when not everything suits the skin. If somebody steps out in the sun, it becomes very red, itchy. There's a burning sensation. If we apply general fragrances, it starts to itch. So this is basically what a broad idea about sensitive skin is. So unfortunately, the gels, creams which we commonly prescribe for acne, they very commonly cause irritation, dryness, redness. So sensitive skin types are not able to tolerate these things very easily. So
Okay.
uh, so the treatment has to be very tailored for sensitive skin. And
Yeah.
a general advice would be that use a cleanser which is uh, friendly for sensitive skin. Like some brands
Okay.
have their gentle range in it. They're called
Yeah.
gentle for sensitive skin, those kind of products. If
Yeah.
you're using moisturizer, try to use the moisturizer with the least number of additives, which says fragrance free for sensitive skin. These kind of labels are there so that the lesser the ingredients, the higher are the chances that you.
Okay.
Then, whenever you're applying something on the face, make sure you always do a patch test for sensitive skin.
Okay.
Patch
Okay.
test meaning apply a little bit for a few nights before you start applying on the face behind your ear or near
Okay.
your elbow. So that way,
Yeah.
sensitive will find out that whether it's suiting them or it's causing some redness or something, so that they can contact their dermatologist. Sunscreens also have to be physical blockers because chemical sunscreens sometimes don't suit them, and
Yeah.
in general protect the face from sun exposure.
Yeah.
So
Clearly.
these are followed. Yeah.
Awesome. So, doctor, I think we've understood there are procedures available. There is a way you can keep yourself hygienic, clean, washing your hair, all of that. But is there something that we can tell our viewers on a regular maintenance pattern? Like we've heard about CTMS, cleansing, toning, moisturizing, sunscreen. What is the right thing that they really need to follow to maintain their skin in an everyday routine, especially to avoid acne?
Okay. So if suppose somebody is dealing with a very mild form of acne, they get like very occasional acne, maybe one acne once in 2 months or 3 months, just before the periods, women normally get acne. So they
Yeah.
need that maintenance. Or
Yeah.
sometimes when you completed your acne treatment with your dermatologist,
Yeah.
then also you have to keep some things in mind to maintain that skin. So it
Okay.
is all general things that I mentioned, like washing your face twice a day. All the general things that I mentioned, they are very, very important. Some extra
Okay.
things that kept in mind are a lot of times we as dermatologists we prescribe some gels which have to be applied even on the normal looking skin on a daily or maybe an alternate night basis. They act as maintenance creams in order to
Yeah.
prevent acne. So if your
Ah,
dermatologist has prescribed you something like that, then make sure you apply it.
yeah,
Psychologically speaking, don't see acne, we feel like kyun lagana hai, chodo. So, but that becomes very important. And
clearly.
one more thing I forgot to mention was that uh, avoid like piling of a lot of makeup. Don't sleep with your makeup on.
Yeah,
Shampoo regularly. So these things, if you do regularly, then that means you're maintaining it well.
right, right. So I think, Doctor, we've spoken a lot about tropical skincare, how we need to really take care of our skin from the outside. What about the inside care? How is diet really helping us in our acne?
Oh yes, it plays a huge role. Like you'll be surprised to know that our dermatology textbooks way back, like the 1950s and all, they when we used to read, like I haven't studied dermatology then, but I've read about it that when people used to read dermatology, the textbooks they had proper paragraphs about okay, this diet causes acne and that causes acne. So there's a lot of research ongoing, but there are some few food items which are clearly linked to acne, which is like a big umbrella term would be the unhealthy food. So there are some foods which have a high glycemic index. Glycemic index is nothing but it is an index given to foods that how quickly does it increase the blood sugar levels after ingestion. So the
Okay.
foods which very quickly increase the blood sugar levels, they are worse for acne. For example,
Yeah,
all the sweet things like chocolates, pastries, ice creams, junk foods, processed foods,
love it.
they have glycemic index. Yeah, the yummy ones. So they are absolutely not good for acne. There are so many studies now which have clearly stated that people who are consuming good amount of vegetables and fresh fruits, they have less acne. So
Yeah,
they are actually protective for acne. Then some for some people, dairy is also a culprit, like
yeah,
milk and milk products, because it contains whey protein, which causes acne. And even the people who consume whey protein, we also very commonly see acne in that population. So
okay.
these are some food ingredients which have a clear cut relation. Rest of the food products, they may increase acne in a particular individual.
Okay. So, my viewers, as we mentioned, what you eat is what you are. So, watch out for what you're eating. The right nutrient is going to give you the right skin. Doctor, we spoke about the tropical skincare, but if I have to understand, every skin type is different. So, what sort of skincare, like moisturizer and sunscreen, should a particular skin type be using? For example, if somebody's got dry skin, what is the sunscreen and moisturizer they need to use? I've also heard that there are some moisturizers that cause acne, so there is so much to be careful of when we're choosing a product. So how should our viewers really select these?
Yeah. So if somebody is suffering from acne, um, one of the components of acne is excessive oil production in the skin. So
Yeah,
generally, they have an oily skin type, but it's a myth that oily skin types can get acne. Even dry skin, sensitive skin, all skin. So, if you have an oily or a very acne prone skin, then it is better to avoid things which are very thick and greasy when you feel them. You should opt for lightweight gels, lotion, these kind of ingredients. The label should say non comedogenic, meaning it wouldn't clog the pores or the duct which causes acne. So, these are some of the labels one should check as a general statement for acne prone skin. But if somebody has
clear.
dry skin, then we need actually the opposite. We need cream
Oh,
based, ointment based products which are heavier, which give a good
yeah,
longer hydration to the skin.
yeah,
And if somebody has a lot of inflammation, then sometimes we also say that use a physical sunscreen instead of a combined or a chemical sunscreen because they can cause a little bit of irritation.
yeah.
So yeah, that's about it.
Wow. So this is quite informative. So people just don't go over the counter and just buy any moisturizer for yourself because it is popular. If you have a dry skin, then you need something which is more greasy. If you have got an oily skin, non-comedogenic is what you need to look out for. Great, doctor. So we do have some questions coming up in the chat window as well. The question is from Faizan, and he says, "How long does it really take to see results from acne treatments?"
Oh, that's such a good question. Okay,
Yeah.
so suppose somebody starts active treatment for acne. You visited your dermatologist. So
Yeah.
ideally, all of us expect that as soon as we start some pills or we start applying some lotions, we should see instant results. Unfortunately, that's not how the treatment works. It can take about 4 to 6 weeks to show some results. So consistency is the key. Be patient. The result is definitely going to come, but a month or a month and a half may be required for oral medicines. If we are giving only topical, the creams, gels, and all, if we are giving only the topical treatment, sometimes it may even take 2.5 months. But acne is one thing which is 100% treatable. The face has to become normal. Like the acne has to disappear. It is never ineffective.
Okay. That's interesting, doctor, to know. So, Faizan, I hope we answered your question. Treatment and patience are both vital. So, make sure you stay patient and you will get results. Doctor, it's very interesting to see most of our male viewers actually writing questions on acne. I was expecting our females to write it, but here we have Ashish saying, Doctor, can using too many products cause acne?
Yes. So, yes, definitely. Using too many products can impair the barrier of the skin, make it more susceptible for the bacteria, the oils, the sweat to enter into the skin and cause more inflammation, more acne for sure. So, using too many actives is never a good idea. No dermatologist ever would recommend that.
Recommend that, yeah. All right. So too much is really too much. So make sure you take little steps and whatever your doctor is prescribing you to do. So Ashish, I hope we answered your question. And I have another female viewer, Neha, who says, "What are the side effects of oral acne medication, doctor?"
Okay, that's a very very good question. So when we talk about oral medicine, uh, they are broadly of two types. One is the antibiotics that we use, and the other is isotretinoin, the most commonly globally used treatment for acne. So antibiotics don't have like a long list of side effects. Sometimes they can cause a little bit of nausea, that metallic taste. Sometimes they can cause stomach upset. They can cause loose motions. So
Okay.
that doesn't happen in too many people, but if it happens, we usually deal with it by giving some probiotics along with it or something. Now, the second medicine that is very commonly prescribed for acne, that is called isotretinoin. That it is very important to know that that medicine should not be taken by those women who are planning to have children. So, because that can have adverse effects on the fetus, the fetal outcome. So it's very important. All the dermatologists, they our training is such in such a way that we always tell our patients that this is like a big warning for this medicine. So because this is a public platform, we should all know that this is one of the most uh, important things to watch for.
Right. Okay.
And
So thank
the
you, doctor.
common side effects are dryness
Yeah.
of the skin, dryness of the eyes, dryness of the lips, which are treatable with lip balms, artificial teardrops, moisturizers, these kind of things.
Great. I think doctor, you just sensed the next question coming up on the chat window. That's from Sana and Pooja, who are saying that can acne treatment cause dry skin and sensitivity?
Yes, absolutely. There is never a patient who consults me for acne and I don't tell them. I always tell them that look, these medicines are the best, they are wonderful, but unfortunately they can cause very dryness, patients often describe that sensation as खिंचा हुआ लगता है, skin खिंच रहा है, इतना ड्राई हो
Yeah.
जाता है, रेडनेस हो जाता है, स्केली हो जाता है, स्किन पील ऑफ होने लगता है. These are very common side effects of gels as well as the oral, some of the oral medicine. So it is very
Okay.
important to moisturize your face and use a cleanser which is complementary to the treatment that you're taking. It's not very heavily loaded with AHA, BHAs, which further cause dryness.
Okay. Great. So I'm sure my viewers are getting this insight that even if they're having a dry skin or sensitivity, it's all going to be treated. What's essential is that we treat acne and we get our flawless skin. Doctor, another question that, of course, our reigning ladies are like doing their makeup and stuff. Is it really worsening acne?
Yeah, sometimes. If there's a lot of layers, there's a very heavy makeup, that too for prolonged periods of time. Yes,
Hmm.
it can cause worsening of acne. It can even
Okay.
onset of acne if somebody's been keeping well, but after that, that close wedding, we very commonly get patients that they had a very close wedding, 3 4 दिन लगातार functions हुए, बहुत रोज रोज बहुत मेकअप लगाना पड़ा, उसके बाद pimples आ गए. So very common, because ultimately we have to understand whatever is clogging or blocking the system can cause acne, and makeup can. Why not? It can. So if somebody has acne prone skin or is currently suffering from acne, use very light makeup,
Okay.
very not too many layers should be applied. Use it for
Yeah.
least of time. Don't sleep with it, or get rid of it, clean it properly, and then sleep.
Okay, great. So, doctor, follow-up question to the makeup. For example, a person has done their makeup in the morning at 9 and has to be up till 8 in the night. Is there a way that we can, just get it more moisturized by using something or reapplying something to just get it more hydrated? Anything that we can do?
Yeah, there are, there are certain wipes, those kind of soft, wet pads are sold in the market. Some of
Yeah.
them have anti-acne ingredients that you can just pat it during the
Yeah.
day in order to clean it.
Okay.
Another option would be removing it, washing it,
Yeah.
moisturizing, and reapplying the makeup. That
Yeah.
is that sounds a little impractical. Then there are some wet wipes that can be used. There are some
Yeah.
facial mists that can be
Mist.
gently sprayed and then patted with a light tissue paper. These can be done.
Awesome.
These.
Yeah, I think carrying a mist can really, really help. I'm going to try that next time. It's definitely very beneficial to not get that makeup off and yet get that hydrated look. Great. Doctor, another follow up question that I had in my mind as well is that should we make any lifestyle changes or any daily self care tips that you think that can help us reduce acne?
Yes, absolutely. Our lifestyle, when we talk about, is majorly our diet, how much we're exercising, our sleep, our water intake, all of that, stress, all of these things. So we are nothing but what our lifestyle is, right? At the end of the day, we are whatever we are eating, we are that. So
Hmm.
diet, like we mentioned, what is good for acne, what is bad for acne. So I'm not going to repeat that.
Yeah.
Um, Apart from that, our if our body weight is higher, there are chances of some insulin resistance, hormonal imbalances. So, weight
Yeah.
loss has been shown to have beneficial results on acne as well, because it normalizes the hormones inside us.
Okay.
So, definitely, exercise is a must. If you have acne or if you don't, exercise has to be there in your routine. Good sleep, and nowadays people are really worried about their pillow covers and also your
Yeah.
makeup brushes. These
Yeah.
have to be cleansed on a regular basis. Your water intake should be good. Your exposure to the outside world in terms of pollution and all, that can be minimized as a part of your lifestyle, then very good.
Wow. So I think little steps, but goes really a long way in ensuring that you have this beautiful skin. So of course, make sure that you're looking after yourself beyond just your skin, but also taking care of your weight. Obesity can be a big issue with multiple things tied to it. So thank you very much for enlightening us with that, Doctor. Doctor, we'll wait for our viewers to share more questions while I had my personal question. So I don't know if acne is related to the weather changes as well. Like that happened with me when I was traveling to London. I got something called as acne rosacea. Now that was completely not in my control. I had to commute, I had to keep changing between weathers. I was eating right, doing everything right, but the acne was incredible. Like I remember having my entire right cheek being covered, and all that acne fading off, and having my left cheek being covered also. So it was just going one after the other every week, and I had the most traumatic experiences. I don't know if my viewers have ever had something like that, but if somebody has had it, what should be the treatment?
So, if your question, I think, was does the weather affect acne,
Yeah.
right? Yeah, definitely it does. So, summers are so not good for acne. Summers and this hot and humid weather. So, when we sweat, our sweat mixes with the oil. It leads to more bacterial production. There's more bacterial overgrowth that
Yeah.
aggravates your. So definitely weather has a huge component to play. In fact, when the summers are approaching, sometimes my patients visit me that summers are coming, we usually have flare-ups. What should we do? So usually we start them on some preventive treatment. That those gels and all which you apply, which will help in preventing acne. So
Yeah.
before that onset of the weather, we can start those things. And if you're talking about acne rosacea, that is a slightly different thing as compared to acne vulgaris.
Yeah.
Acne, what is all we've spoken about acne. Rosacea is a different problem in which the skin is very sensitive. There is a lot of redness, which is very annoying to the patients if they step out in the sun, or if they're angry, or if they've eaten something hot, spicy. Even that can lead to redness. And there are a lot of acne-like pustules, papules, those kind of things are there. So
Yeah.
the type of rosacea is a little different when it
Yeah.
slightly different from acne.
Yeah, clearly. So I hope nobody has to deal with it, because I have been feeling traumatic dealing with it, and I still have scars, doctor. They've not gone. I need the right treatment for the scars now. All right. Another question from Abhishek, and he says, how do you choose the right acne treatment for your skin type?
Okay. So the right acne treatment is actually decided by your dermatologist. So if you have acne, you must visit a dermatologist, understand
Clearly.
your skin type, understand what type of products are going to suit you, which face wash, cleanser, your routine, how it should be. And
Hmm.
if your acne is mild enough to be dealt by only with topical gels and all, you. If it is severe, they might even start you on oral medicines. So the
Yeah.
treatment really depends on your dermatologist.
Clearly. So, Abhishek, don't worry which treatment to choose. Leave it to the doctor. Let the doctor decide, and they're going to do justice to it. Great. Doctor, any other tips that you want to highlight before we really go ahead and wait for any more questions coming in?
Yeah, very commonly we see that um, patients come to us. My friend was applying this, I applied this, but it didn't help me at all because it might help you, it might not help you, it might even worsen your problem.
Yeah.
So absolutely do not use your friends or your relatives' creams, lotions, or medicines. It's a very tailored approach. It differs from person to person. And a lot of times, parents come up to me and
Yeah, I think clearly no monkey see, no monkey do. Your friend is using a cream, that doesn't mean you can use it too. There's a different skin
ask,
treatment for every skin type. Doctor, we're trying to catch up with you, but we can't hear you right now. So, yes, I think super informative insights from the doctor herself. There is a lot of treatment, and what I'm really happy about is that acne can be treatable. Like, I know of my friends who've had acne throughout their life, and they've been dealing with it, trying to fight it, but have lost, trying, and losing hope is something that you shouldn't really go ahead with. Ensure that you take care of your skin, because you can treat your acne, but you need the right doctor. So make sure you reach out to the right person to get your treatment right. So we will have the doctor once again join us before we really wrap up this session. But for me personally, this session has been super, super informative. Do let me know in the comment section if you have any more questions, because I think I learned a lot about acne vulgaris, acne rosacea for that matter as well, that I shared. Like, imagine having your entire right cheek filled up and then that vanishing and having the left. Yes, doctor. So we'd really like you to have your closing remarks about, skincare.
I'm
And I was telling,
sorry, I don't know why this internet is breaking at this particular moment, but
we're talking about acne breakouts, so it's all breaking up, but don't you worry. Don't you worry. I think we've got a lot of
yeah,
information.
absolutely, yeah.
So, doctor, I think we have your screen frozen at the moment. And I think I've highlighted my viewers very clearly of all that doctor just spoke about, taking care of your skin, how we can really keep it clean, healthy, and no issue is a big issue, because your acne can go away if you treat it right. Any more viewers who really are dealing with acne, feel free to let us know. Hello, doctor. Welcome back.
Yeah. Yeah, so I've been trying to say this one line, and I don't know why my connection seems to be breaking up. So, very commonly, parents come to us and tell us that we've also had acne. Why bother treating it? It is so normal, it's not even a disease. So, one very important closing remark would be that um, the teenage, it's your child who's, these are the formative years of that child. they
Yeah,
they are developing a personality. They're already
yeah,
so conscious about their bodies, and believe it or not, acne has a huge psychological impact on our body, on our
yes,
mind. So
yes,
that time is also a time in the lifespan of that individual. It's not that it doesn't matter how that person is feeling that time. So
yeah,
in order to make them more confident, in order to make those, that period of maybe 1 2 3 4 5 years, also make that time period a normal period in their life, and not to
yes,
traumatize them. It's very
clearly,
important to treat acne. Everybody talks about that, ठीक है scars आएंगे इसलिए treat करो, but that's not the only reason. That is, at that point of time, that individual is living, wants to live their best life at that time. So it's very
true that.
important to treat it.
Yes, clearly. So be there for every friend who's dealing with acne, is what I can say, because I've dealt with it and I know the trauma behind it when it suddenly hits you. But don't worry, acne is not a disease, as doctor said. It's just a condition and we can treat it really well. I think with that,
Yeah.
we'd really like to wrap up, doctor. I want to really, really thank you for sharing in your valuable time and these amazing suggestions to help us treat acne. It has truly been very informative for our viewers as well to understand a lot about acne. And it's great to hear you, Doctor. We really
Thank
look forward for many more such sessions. And thank you very much for our viewers giving in so much of their valuable time. Thank you for participating and engaging with these amazing questions. Stay connected to our beautiful Spotless Skin page. Stay tuned and thank you very much. Take good care of yourself. Bye bye.
you. Bye bye.